Hello and welcome. Today I'll be talking about white coat hypertension. I'm sure we know what hypertension is, and so many people around the world are being treated for hypertension. But this has a different slant. It's white coat. So, what about white coat? Traditionally, doctors put on white coats, even though that's not exactly what it is at the moment. Quite a number of doctors in different countries now would wear different either normal clothing or scrubs. But in times past, it was very common for doctors to put on white coats. And so, what is white coat hypertension then? It's a raised blood pressure in the clinic or hospital setting while having normal blood pressure at home. In other words, this patient comes to the hospital to see a doctor. In the course of this doctor checking the blood pressure jumps very high. However, that same patient has a normal blood pressure at home. And so when you have this condition where there is a disparity, a difference between blood pressure taken at home compared or versus blood pressure taken in the hospital or doctor's office, then you say the patient has a white coat hypertension. Why does this happen? There are a number of reasons, particularly because some patients tend to be nervous or anxious when they're in the hospital setting or in the doctor's office or when the blood pressure is about to be checked. There are a number of things that could possibly, I use the word possibly, may be responsible why this happens. Sometimes, we may assume that it should be a normal place or of experience for people, but that's not exactly the case. People don't tend to come to the hospital except something happens. Either they need to see a doctor or they have a relative they are going to visit. It's not a normal place for people to go to. But a doctor goes to the hospital virtually every day, so he becomes accustomed to being in that environment. But for you as a patient coming there to see a doctor, it can be a reason for some people to become unduly nervous. It may also be a way of, coming to the hospital may be a reminder of a memory of a death of a loved one. It could, the sight of seeing people that are sick could trigger some form of anxiety or nervousness. It may be the sight of blood. It may be the stress of keeping an appointment. It may be the stress of even getting the place to park your car. Or maybe you've had an argument, or at that time, you are really emotionally stressed. You've had an argument or quarrel with somebody, and so may not just be the best time for your blood pressure to be checked. And so these scenarios may result in elaboration or release of stress hormones. And so when your blood pressure is checked at that time, it's elevated. But when it's checked at home, it's normal. So if that happens, we refer to that as white coat hypertension. Why is it important to diagnose this accurately? The reason being that if you have normal blood pressure at home and you have elevated blood pressure in the hospital, the doctor needs to be able to tell categorically whether you have high blood pressure and so require medications. Otherwise, if what you have is white coat hypertension and you're placed on medications when you don't need them, the problem with that is that when you get back home, your blood pressure becomes normal. Meanwhile, you're already placed on medication. The consequence of that is that your blood pressure now dips, it drops. So you now have, rather than hyper, you now have hypo, which is low blood pressure, and that can make you feel dizzy and cause its own problems. The other reason why it's important to clarify this is that if you do have blood pressure that is high at home and also high in the hospital, then that means that you truly have a raised blood pressure, and there is a strong case for you to either be placed on antihypertensives, that's blood pressure, to control your high blood pressure, or to increase the dose if you're already on high blood pressure medication, or to change the medications or to add on new medications. So the scenario is very different between a patient that has a normal blood pressure at home and a raised blood pressure in the hospital from a patient that has a raised blood pressure at home as well as in the hospital. How do we address this? Now, you play a very, very crucial role in addressing this situation. Now, if I were to say, when you come to the hospital, just feel calm, feel relaxed, And patients will tell you, a patient may say, or you may say, I've tried that, doctor, it didn't work. I get very anxious once my blood pressure is going to be checked. Then this is what you should do. Number one, get an ambulatory blood pressure machine. Get a machine for checking your blood pressure at home. In other words, do the check at home. In the home environment, it's your house. You're very familiar. It's an environment that's very familiar to you. So you will not be under pressure or tensed in your own sitting room, in your own bedroom. So check your blood pressure at home. Get a machine, do that for yourself. Now, the next thing you need to do is not just checking randomly, it's checking either on a daily or in a very scheduled routine, but have these values recorded in a diary. When you have these values recorded in the diary, when you're going to the hospital, take that diary along with you. So the doctor is able to see what your blood pressure readings have been over a period of, say, a week, 2 weeks, 3 weeks, 1 month, compared to a simple check on a hospital visit. Usually, the doctor will defer to your blood pressure readings that have been taking place over a period of time compared to a single blood pressure reading in a hospital setting. By so doing, you will significantly prevent or avoid a situation where you're mistakenly diagnosed with high blood pressure if you don't have it. Also, arrive at your appointment as early as possible so you can have enough time to relax. Don't get to a hospital appointment and then soon after you arrive you have a blood pressure checked. That's not the way to go. You need to have some time, some minutes to at least get rested, feel relaxed, and thereafter you can have your blood pressure checked. If you're able to do these, you significantly will avoid a situation where you are mistakenly diagnosed with having elevated blood pressure when you don't have it. I hope you've learned something. If you have, then subscribe, like, share, and then see you again. Thanks.